Hey, autoimmune warriors, welcome to the Stronger Than Autoimmune podcast. I am so fired up for you to be here. If you're navigating life with an autoimmune condition, you're in the right place. I am your host, Des, and I am not just a podcaster. I am right here in the trenches with you as a fellow autoimmune warrior. We're diving into real, uplifting stories and some seriously smart expert tips and simple lifestyle tweaks that can make a difference in how we feel day to day. Now I've got to give a huge shout out to my amazing listeners. You're the heartbeat of this podcast, and I'm so grateful for you tuning in. If you're loving the vibes, here is how you can keep the love flowing. Drop a rating on Spotify, share a quick review on Apple, or pass this episode along to a warrior buddy who can use a boost of hope. Here are some patients that are killing it for our community. Workers with Autoimmune Ailments Alliance. These folks are fighting the good fight for students and workers like us with autoimmune conditions. Want to get involved or learn more? Swing by WAAA.org. They'll love to have you. Leap Cure. They're all about hooking up patients with cutting-edge clinical trials and putting our voices front and center. Check them out at leapcure.com. Adapt Naturals by Chris Kresser. They offer nutrient-packed supplements based on science. Snag 20% off your first order with my code DEZ, D-E-Z, at Adapt Naturals. From my heart to yours, I'm sending you nothing but love and good vibes. Let's dive in together. Hello, autoimmune warriors. Please welcome Danielle Shears to the podcast. Danielle is a nurse with over 30 years of experience in neurology, cardiology, and orthopedics. She holds a BSN from UNC, an MBA in healthcare administration, and certifications in clinical neuroscience and functional nutrition. After overcoming her own chronic illness by addressing physical, emotional, mental, and spiritual wellness, she founded Better Choice Health LLC. Through her show, through YouTube, Danielle empowers listeners to tackle chronic fatigue, autoimmunity, pain, and stress using holistic root cause approach focused on nutrition, lifestyle, mind-body practices, and spiritual well-being for lasting health and vitality. So thank you so much, Danielle.
Thank you. And thank you so much for having me, Desiree.
You have your own YouTube channel and you are really making waves. You really are trying to get people to think and not just doing one part of physical health, but utilizing it with nutrition. And you're showing how to do that in your channel and in your books. So with all that being said, I guess we should start at the beginning.
Okay.
With your biggest challenge you faced with your onset illness, how did that shape your well-being to healing?
Well, really, I think the biggest challenge was just not being able to describe what I was feeling. And, because I'd have pains here and pains there. And as a healthcare professional myself, I recognize the challenge when you have a patient that can't quite describe what they got going on. Because now, what do we do now when I can't understand what you're going through? How can we help you? And so the frustration was coming from knowing both of those. And so, because each time I would go back into the doctor, it would be the pain would be in another area, and I'd have to describe how that was feeling and how it went away after a couple of days, but then now it's on the left side, and then it moved to the ankle, and then there was a pain in my chest, and it was all over the place. So I almost felt like a hypochondriac or something, because here I am back again trying to describe to you what's going on, and it's not making sense. And I was getting no answers, which I wouldn't have. And so this really shaped my journey and a path to healing, because I started journaling I had to start journaling everything and tracking everything. Okay, the onset of this pain was when it started now, and then it stopped, and then it went to this side. And so as I did that, what did I eat the night before? Did I get enough sleep? I knew enough to say, okay, let me start tracking it. Then that way I can come with a better history of what is happening, and then maybe it'll be, more explanatory.
Yeah, yeah. It seems like you took more of the scientific approach as a medical professional. So you don't seem like a hypochondriac. It also seems like you said, you had that knowledge, so you were able to kind of break things down. And that is so helpful to really see everything tracked down as a journal. Did you find any patterns after a while? What did you notice?
Well, it helped them recognize that along with another one of the lab values that came back abnormal, it helped them recognize that this is probably an autoimmunity issue. Because before that, there was just really no real red flags directing them in any direction. So I ended up seeing like 4 or 5 different specialists, having many labs drawn, imaging drawn, because again, if I'm complaining about an arm, a leg, a shoulder, a foot, they want an x-ray, they want to, they want imaging. And so, trying to avoid going down all those paths as well, it just was like, okay, let me help pinpoint this. But yeah, that was ultimately what led me to seeing rheumatology.
Okay. And what did you end up having, or did you end up getting diagnosed?
So that was the other thing, because when I first initially experienced the inflammation all over my body, which I woke up with visible signs of it, my hands were swollen, feet, legs, and I was swollen so bad until my skin was tight and it was painful almost to walk. And that was many years ago. And then years beyond that, they couldn't figure out what was going on. But as a child, I had psoriasis. And so when one of your lab markers, such as your ANA, is off, that's what sends you down that rheumatology route as well. And because that came up again, which I hadn't suffered from, I hadn't had any breakouts in years. Like I don't have visible rash of psoriasis anywhere for many years. So they were skeptical of that. But when they can't come up with anything else, psoriatic arthritis became the default kind of diagnosis. Thankfully, not to say that I wanted anything else, I'm not complaining, but it was still the difficulty in, okay, I don't have XYZ, but I don't feel well. I knew something still was wrong. And so, that was just the challenge of it.
Can you share, since you went to many doctors, you were journaling, you were tracking, can you share a turning point or a pivotal experience in your journey that helped you start reclaiming your health?
It was when it was a couple of years ago, and went to the doctor, just not feeling well. I felt like this heaviness, tightness in my head, and I just did not feel well. And I went for a physical, and my sedimentation rate was high. It was out of the range, and sedimentation rate is something that they used as an inflammatory marker. It notes that you have inflammation in your body. And for a woman, the normal range is like 0 to 29, and mine was 55. Now, there was no visible outward sign of inflammation. I didn't have any injuries. So it's like, well, why am I inflamed? And even back when I experienced the outward sign of inflammation, even then my sedimentation rate wasn't that high. There's no answers within the medical field, but yet they wanted to just kind of put me on, just the lowest dose of a biologic. But I was uncomfortable with that without formally knowing what was wrong. I didn't want to just start taking a medication. And that was when I was like, okay, let's do something different. And 2 weeks prior to seeing my rheumatologist, about 2 or 3 weeks prior to that, is when I saw this program come across for functional nutrition. And it talked about nutrition and the power of nutrition and how it could reduce inflammation and that sort of thing. So I asked my doctor when he said, well, let's try this medication. Do you want to try that? I verified that I wasn't going to die if I didn't do it before I just refused it. At that point, I just knew I wanted to just try an all anti-inflammatory lifestyle. I've got to do something different outside of just going back and forth, trying to get answers, from, the medical field. And so that was the pivotal point.
This is a great point because in asking this question because you took it upon yourself to do something different. You have a book called My Own PCP. PCP, everybody knows, but I'll just say, just in case, personal care provider. Please talk about how you started that book and what made you talk about being your own PCP.
So, and where that stems from, because like you said, we have a PCP, which is a primary care physician. It could be a primary care provider. But as I was trying to empower other people after seeing what had happened with myself, as I was trying to empower people, I was like, we actually have a sick care system and not really a true healthcare system. And the sick care system is there to take care of the sick. Now, does that mean leave the sick care system alone? Absolutely not. But it was just bridging the gap. I'm going to build this team. I'm going to keep my medical PCP, but as I'm building my own healthcare system or my own system, if you will, I'm going to be my own PCP, my own personal care provider. Because outside of the four walls of your doctor's office, guess whose responsibility it is?
You see them for 15 minutes, and I
Absolutely.
mean, you're in your body and you're in your own environment the rest of the time. So
Absolutely. And so that's why I put that book, and it's actually a workbook where people are able to work through. And so there's a lot of tips in there about sleep therapy and stress management and other tips in there, as well as some tracking sheets for people that have high blood pressure and diabetes, some of those numbers that people need to track outside of the doctor's office, because that was the other trend I was seeing, where you go, you tell the doctor, they give you a medication, and then you don't even track. You don't even write anything down. You don't even keep up with what's going on. So how do we even know the medication is working? So that's where, the workbook came to play for my.
how did your 30 years of nursing experience across many different specialties, you have neurology, cardiology, influence your approach to holistic healing?
So because I understand the physiology of both of those, I also understood the interconnectedness that they have. For instance, from a cardiological standpoint, which is our heart system and our arteries and veins and nerves, I recognize that when you have something like high blood pressure and cholesterol together and they're out of whack, it can ultimately lead to a stroke. And a stroke is a neurological condition. So as I'm suffering in the cardiovascular area, I'm actually impacting the neurological. So understanding that interconnectedness and the interconnectedness of the neurology system with the whole rest of the body, I understood that you have to take a holistic approach. You have to look at the whole body. You have to look at more than just the pain right here. You also have to look at inflammation. What did I put in my mouth? You have to look at stressors. You have to look at sleep. You have to look at dehydration. You have to look at the mind. What are you going through mentally? If you're stressed at work, I often think about, you might have it going on in one area, but if the mental is not there, if the spiritual is not in alignment, if your financial is not in alignment, if your social well-being is not in alignment, something's going to suffer. And that's where true health is. And so that's how I was able to, take what I know from my nursing experience and say, hey, this has to be a holistic approach.
Yeah, I totally agree.
Mm-hmm.
I know with people that go into the nursing homes, they've done a study where everybody's feeling sick and tired, but then they put music on from when they were younger, and all of a sudden they lift up. And that just shows how powerful the mind is, but also that we need connection to feeling better. It's not just about nutrition. It's not just about exercise. It's connecting to what makes us feel happy and joyous.
Absolutely. Absolutely.
And I know that looking at your YouTube channel, I really enjoy it because you bring nutrition in, but I've noticed that you also bring the spiritual well-being into your health practice. How do you guide clients in this area?
So I'm a woman of God, I'm a woman of faith. And so just growing up, I saw healing really taking place within the church. And, we just didn't see a lot of that sickness. But my mom, over 20 years ago, gave me this book, and it talked about spiritually rooted disease. Now, 20 years ago, didn't pay much attention to it. Even 10 years later, I hadn't paid attention to it until I experienced that inflammation, like I noted before, till I experienced that, because they started talking about family history, and it started to trigger in my mind, like, wait a minute. And then it also talked about that about 80% of all diseases have a spiritual root. Then another thing that helped me kind of connect the dots is I looked at a scripture that says Psalms, it said, who forgives all our iniquities and heals all our diseases. And then there were numerous other scriptures that talked about really the intent for God for our lives. It wasn't for us to be sick. That was never God's intention for our lives, for us to be sick and be on medication. And so the book also went on to talk about we really experience disease a lot of times when three things happen. One of three things happen, or maybe all three. And that is a separation from God, a separation from ourselves, or a separation from others. That directly led me to the separation from yourself, because think about auto itself, the body's attacking itself. So if you look at that spiritual root, and with autoimmunity, and in this book it talked about with lupus and rheumatoid arthritis and the other autoimmune issues stem from self-hatred, self-bitterness, and guilt. And so as I started to look within, and then another one was something about forgiveness. As I started to look within, I had to dig deep and look back. Okay, let me look at my history. I had to figure out, who do I need to forgive? And then I really did realize I wasn't feeling great about myself or some guilt. So as I began to address that, and as I even looked at arthritis, because when they said I had psoriatic arthritis, and then the joint pain that I was having, it was bitterness and unforgiveness. And I knew there was specific people in my life that I needed to forgive. The more I looked into it, the more and more the dots were connecting. Like, this is a spiritual thing. And then I realized whatever the world of science can't figure out, you best believe it's spiritually there
Rooted.
must be a spiritual tie. If science can't figure it out, guess what?
Yeah.
And so, even looking at cardiovascular health, the spiritual root was like fear, anxiety, and stress. And you've heard down through the years, stress kills. That's where it led me. I'm able to kind of help guide people. There may be people that don't even, have a relationship with God or believe in God, but I'm still able to kind of direct them in the area of, well, let's look and see, is there some forgiveness? Let's look at the traumas and things that you have experienced in your life. For those that do believe in God, there's spiritual partners and prayer partners that I can lead them to as well to help get them through that aspect of their healing.
That's beautiful. Yeah, because so often that we look outside of ourselves to heal, when if we turn inwards, we can see what it really is. And I'm glad that you give some direction, because some people don't know where to start with that journey of spiritually healing. How does your work at Better Choice Health LLC differ from conventional medical approaches to chronic illness?
So, and I think it starts with the comprehensive health audit that we conduct, and it goes beyond just symptoms and diagnosis and medication. Like, we look at your extreme personal history, full family history, and we look at past traumas. And we, as well as lab values and other things that help us indicate what might be going on. We really try to get to the root cause. In conventional medicine, they're treating the symptoms. They're they're coming to a conclusion of a diagnosis, and they're treating the symptoms. They're not left with a whole lot of time to figure out the root cause. We are getting to the root cause, because if you don't address the root cause, it can come back. And if you can get to the root cause, now we're talking about long-term health, not just a 30, 90, 60-day fix. And you not necessarily have to be, on chronic medications, for instance, for life. Now, there's just some things that might be the case. I'm not saying that it applies to everyone. So I think that's the biggest thing, is just how deep we look into a person and we make it very personal.
What information do you need, or what does your first appointment look like with the individual that starts working with you? You know, what, I know you probably do get labs, but how far back do you need the history?
As far back as they can remember. And even if they have to ask parents, and if they have deceased parents and they just cannot remember, then we're going to go back as far as they can remember. But there's generally some telltale signs. Did your mom ever tell you that you had a lot of ear infections? That's something that, that comes up. If you did, that tells me that you were on antibiotics quite often. And that leads us to another area of where we definitely got to address that gut, because anybody that has ever had antibiotic treatment, which, a lot of us have throughout our lives at some point, but it really has some after long-term effects on our gut health when we've had to take antibiotics and some other things.
Beautiful. What role does functional nutrition play in your method, and how do you tailor it to individual clients?
It is a huge part. It is a huge part. And I think this is one of the areas that can be neglected. And one of the areas that I found very alarming that is not even addressed in medical schools, as physicians, at least back in the day, were not required. It was an option to take a nutrition course, a part of medicine.
Mm-hmm.
So what we are putting in our bodies has to be important. And then I look at the different aspects of nutrition, like protein, which it is imperative for tissue repair and collagen formation. And so you have somebody that's sick and suffering with something, they need protein. Or even the energy levels. If you have low energy because you lack nutrition, then your healing is delayed. That's the reason why a lot of times when people have to go in for surgery and that sort of thing, they receive, the IVs and the fluids and things like that. And even prior to that, they're given certain instructions to get your body prepared for what it's about to go through. And then I even look at like vitamins and minerals and things like that. Those are things that impact your immune function. So knowing that healthy fats and some of these foods are imperative to the healing process. As a nurse, when patients are in ICU, there's one of two things they are getting. They are getting IV fluids and they are getting nutrition. They're not able to eat. If they're intubated, they may not be able to eat by mouth, but they're going to get a form of nutrition, preferably within 24 to 48 hours. Or at the latest 7 days, and then that's where they'll put the nutrition straight into the bloodstream. That's how important nutrition is. So, as I stated, with individualizing everybody's approach, that's where functional nutrition comes in, because we are actually addressing what you have going on. So, a person with high blood pressure, high cholesterol might be on a different eating regimen than somebody that perhaps has kidney disease or is suffering with a thyroid issue, or it'll be different from an anti-inflammatory regimen, for instance. So that's how I'm able to individualize. That's the functional part of it, to help your body heal itself, which is what it is meant to do.
Yeah. And it sounds like really finding the nutrients that you need for your individual body. And like you said, somebody that has a kidney problem, well, you're not going to probably give them a lot of protein.
Right.
And it's hard to digest. So,
absolutely.
Can you share a success story from a client who transformed their health using your comprehensive approach?
So I think of one client that I had, and she came to me and having been diagnosed with stage 3 kidney disease. And she stated that just several months prior to that, she was kind of given a clean bill of health from her provider in terms of her lab values being normal and things looking good. But then I go to this appointment, just as a checkup, and now I have stage 3. How did I go from doing okay to stage 3? And it's funny how kidney disease works, though. So it's not totally surprising that it showed up that way. I bridge gaps. I don't dismiss medical advice and all that kind of stuff. I actually work collaboratively with physicians in terms of, okay, can we order this lab and that sort of thing. So I put her on a regimen, and we went in with addressing the health, not even expecting, or not even necessarily expecting to reverse the kidney disease. And because kidney disease can get to a certain point where it's, it's just going to be what it is. But 6 months after starting the regimen that we talked about in a lifestyle and decreasing inflammation and things in her body, she went back to the doctor and had tests. And he was like, I'm not sure what you're doing, but it looks as if you have put a halt on the progression of the kidney disease. Because it is said that with stage 3 kidney disease, it can be reversed depending on how far gone it is. The stage 3, once you get to 4 and 5, that's when other things have to happen. He said it appears that he would put a halt to the kidney disease because some of those markers started to trend downward. And other people have come off of medications or decreased the amount of medications. And again, I don't take them off the medications. I just help them get their bodies to, a normal state, or get their bodies in the best state of health so that it can heal itself.
That's wonderful. Congratulations on all of your work. And I'm so grateful that you do these healing lifestyle choices with people, because it makes a big difference.
Huge difference.
How do you balance mind-body practices with the practical lifestyle changes to help clients with stress or chronic pain?
It's really it's a daily management thing. And I think the misconception is that people think, like, even with stress, as you mentioned, people think, oh, well, I'm going on vacation at the end of the month. I can't wait till I go on vacation. They think that's when they're going to de-stress. And what people don't realize is you need to de-stress every day. That traffic jam you were in, that person at work that got on your nerves, or whatever it is, you don't recognize, so much that those cortisol levels, went up. That's a stress reaction. And the cortisol needs to be brought down every single day to keep us out of that stress, category where we're now impacting our body. I take my clients through, they have, kind of a checklist of a morning routine and an evening routine where they're basically checking in with themselves. There's certain things they got to do in the morning, and then that evening checking off some of the other things that you need to do at night. So daily management is how I'm able to help people put practical lifestyle things. And it's difficult for a lot of people because you're just not used to doing it. A lot of people don't even want to do it, which is fine, but it becomes a necessary evil when now I need to do this daily in order to manage what I have going on. So really it's the daily management.
Yeah. I personally know that for me, it's like I do it every once in a while, and then you get out of the habit of doing it and you're like, I guess it really did make a difference.
I was a victim of it myself. I mean, I was horrible. I had to start over every Monday. I would inevitably get off track. I just literally am doing things that I know worked for me because I experienced it myself. That's how you stay on track, because it becomes a lifetime situation when you're able to be disciplined enough to keep on in the consistency. And that's what it took.
Yeah, it's the consistency. I think that really gets people. It's easy to start, but it's hard
to maintain. Yeah, because life. And
yeah, life is life.
It's life's, and
for sure.
Without tracking some things, yeah.
What is one common misconception about chronic illness or autoimmunity that you wish people understood, since you deal with it with others and you've dealt with it yourself?
Recognizing that just because it ran through your family doesn't mean you have to have it. I think a lot of people say, well, yeah, your diabetes runs in my family, or this runs in my family, and it ran through your family. But if it's not bloodborne, there are some genetic predisposition. There are some genetic things that will make you more likely to get certain stuff. But it's the people that sit back and settle for it runs in my family. And that's a misconception with a lot of disease processes that, it doesn't have to, because there's something called epigenetics. There's something that, and really, you have genetics, you have the genes that you have, but there's something that has to happen in an external environment, something you put in your mouth, some lifestyle change has to happen for the gene to be turned on. So to just put yourself in that category and assume, or that you're just aging, that's a part of aging. Another misconception. It doesn't have to be. It doesn't have to be. Mm-hmm.
Yeah, it's almost you're almost giving yourself a disservice.
Absolutely. Sitting back waiting to get it.
Yeah.
I spoke at an event one time and a lady came up to me afterwards. She was like, "I'm so glad you said that." She was like, "Because I literally was just sitting around waiting to get cancer." Because several people in her family, a few people in her family had cancer. And I'm like, how do you sit around and wait to get something?
Yeah, that's not life. That's not living life.
That's not. Yeah, so.
I want to thank you. I have 2 more questions left. I always want to give my listeners something they can utilize listening to this podcast. So would you share 3 practical advice or strategies to give others to overcome autoimmune conditions or regain strength in their lives?
Address the whole body. Address it all. And again, I encourage you, if you have addressed the nutrition and you know that you have, you're eating the right things, you're moving your body, I encourage people to walk. It's not about getting a gym membership and getting the best fit, but just walking has tremendous benefits. So moving your body, making sure those joints stay fluid. In some cases, getting the spinal cord corrected, increasing your posture, improving your posture, improving the way you sleep, how long you sleep. Sleep therapy is like huge because, like I said, that neurological system is huge in healing. And then just anti-inflammatory lifestyle, detox. We have to be careful in the autoimmunity world. You have to be careful with some of the detoxing, but what are some of the things in your life, maybe household products, lotions, perfumes, deodorants, things like that we're using, those extra chemicals and things that we're exposed to, that is just triggering that autoimmune response each time we use it, each time we, so really digging deep and working with someone that can help walk you through that process if needed, to say, okay, how do I detox my life? And not just a gut detox. I'm talking about detoxing your life, detoxing negativity, detoxing, like I said, the spiritual rooted stuff, unforgiveness, some of the bitterness, the self-hatred. Autoimmunity is a tough thing to get through. So how are you feeling about you? Have you forgiven yourself? How are you waking up every day? Are you down on yourself? And it might not be your fault, but it is your responsibility at this point to come out of it. That is what really helps to address autoimmunity, because it is a tough one. It's a tough one. It's tough to diagnose and it's tough to manage if we're not looking at the whole person.
Thank you so much for your tips. Mm-hmm. And how can people work with you or find you?
So you can find me on my website, DanielleShearsCoach.com. I also have a free that I'll share with you, Desiree, too, where they can just acquire 5 essential lifestyle changes to manage chronic illness. And there's some tips that you can have there, but you can go on my website and find it, and you can just go into free resources and find it. I'm also on Instagram at the Better Choice Health, and then on Facebook at Better Choice Health.
Awesome. Thank you so much for your time.
Thank you so much. I appreciate it.
Guess who I just connected with, warriors? Leap Cure. Leap what? Leap Cure. Leap Cure connects patients with clinical trials to make research more equitable and efficient. Listen to their latest clinical trial.
If you've been diagnosed with thyroid eye disease and are seeking potential new treatment options, you might be interested in the LIDS clinical trial. If you're 18 and over, have a diagnosis of Graves' disease or Hashimoto's, and are interested in potentially participating in research, You can fill out a short questionnaire at lpcur.com/TED. You'll be connected with someone on the team to determine whether it might be a good fit for you. Check your eligibility and learn more at lpcur.com/TED.